Hello.
Hiya. Is it Joan?
Yeah.
Hello, my name's Kat. I'm one of the nurses here today. I've come to take some obs if that's okay. Yeah. Right. So, just going to take your blood pressure. You let me have your arm. How are you feeling?
I'm a bit lightheaded.
Are you? Okay. Let's see what these obs show, shall we? Let's put this on. Okay, just going to go a bit tight on your arm. Just going to take your temperature. Thank you. That's all fine. Okay, let's just put these in. Feeling a bit lightheaded, did you say?
Yeah, a bit dizzy.
A bit dizzy. Okay, fine. So your blood pressure's quite low at the moment and your heart's beating quite fast. Let me go and tell the doctor and I'll see what I can do, okay?
Okay.
See you in a minute. Hello?
Hi, Medical F1 on call here.
Oh, hello, doctor. I'm Kat, one of the nurses on Benson ward. I've got a patient who's got quite a low blood pressure and she doesn't feel very well. So would you come and review her, please?
Okay, and how low is her blood pressure? Sorry?
So it's 85/50.
Right, and what's the patient's GCS at the moment?
So it's probably like 15 at the moment. But yeah, she is feeling quite lightheaded.
Right, okay. Yeah, that blood pressure is pretty low, isn't it? So let's lie her flat on the bed.
Okay, yeah, she's on the bed.
You can even tilt her backwards a bit, so, lie her nice and flat.
Okay.
And I'll come up and have a look at her in the next few
Okay,
minutes.
doctor, I will let her know. Thank you.
Hi, hello there. I'm Will, one of the orthopaedics doctors.
Hello.
Are you Mrs. Brown?
Yes, but you can call me Joan.
Oh, okay, brilliant. Joan, so look, I understand you're not feeling great, is that right?
Yeah, I feel dizzy.
Okay, yeah, the nurse was quite worried about your blood pressure as well. So you're 68, is that right?
Yes.
Okay, and 5 days ago you came into hospital after a fall at home? Yeah? Okay. And then you then had an operation to fix the bone in your leg, and that was
Yeah,
done...
there's still some pain in my leg.
Oh, I'm sorry about that. And the operation, that was 3 days ago, was it? Okay. And how have you been since the operation, aside from the pain that you've got?
Just not right, really. I tried to have some tea earlier. It made me sick, doctor.
Oh gosh, that's horrible for you. Sorry about that. And have you been experiencing anything else at all, aside from feeling sick and a bit of pain as well?
No.
No, okay. Well, Mrs. Brown, I can see from the notes that you have a few different medical problems, so diabetes, hypertension, so high blood pressure,
Yeah.
and chronic kidney disease. Are you aware of all of those?
Yeah.
Okay. I'm actually just going to have a look at your drugs chart at the moment as well, if that's all right. So,
Okay.
Nurse, have you got that?
Yes, here you go.
Okay, lovely, thank you. Let's just have a quick look. So, you are on ramipril, benzoyl-flumothiazide, simvastatin, metformin, paracetamol, ibuprofen, and Oromorph. Is that right? And have all of those been given today?
Let me have a look. So yes, they've all been given, apart from the simvastatin that's not due till this evening.
Okay, great. All right, thank you very much. Okay, Jane, is it all right with you if I just have a listen to your breathing, listen to your heart now,
Yeah.
if that's all right?
Yeah.
Okay, lovely. Let me just pop this here, and we'll just move that gently to the side as well. Okay, Kat, could you repeat the obs for me? Sorry. What were we
Okay,
looking
yeah,
at?
that's fine.
Yeah, brilliant. Okay, so I'm happy that Jane's airway is patent. Her last recorded oxygen saturations were 97%, so I don't think she has a problem with her oxygen at the moment. She's been talking in full sentences, and you don't look breathless at rest to me, Jane, so that's good.
No.
Okay, so I'm just going to have a listen to your breathing, if that's all right.
Don't mean to sit up.
If you're able to, if it's
Yeah.
not going to cause you pain.
Yeah. Oh.
Do you want me to give you a hand?
Yeah. Okay.
There you go. Thank you very much. And since you've done that, I'll have a listen at the back first. Lovely. Okay, good. Have a quick listen at the front. Okay, and you can relax back if you'd like. So there's equal air entry bilaterally and chest expansion symmetrical as well, so that's good. Can I just have a quick feel of your wrist? Is that alright? Have a feel of your pulse? Okay, nice and warm. And your pulse is nice and regular as well. It's quite fast though. And actually your hands are a bit cool.
So the pulse is 110 and the repeated blood pressure is 95/50.
Okay, can I just have a quick squeeze on your fingers? That's alright.
Yeah.
The capillary refill time's about 4 seconds by the looks of things, so she's a bit shut down. And are you able to stick your tongue out for me, sorry, Joan? You are looking a bit dry. Are you feeling thirsty at the moment?
Yeah, but I just feel quite sick.
Yeah.
So the registrar overnight started some fluids. They're just up here, doctor.
Okay.
It's running at 80 mils an hour at the moment.
Fantastic, okay. We do look a bit dehydrated to me. Is it okay with you if you just have a look over to your left-hand side, so towards me here? No, I'll just move your hair gently out of the way, okay. Okay, so JVP doesn't look raised to me. Have we got the most up-to-date blood pressure, Kat, sorry?
Yeah, so it's 95/50.
95/50, so it's still quite low, isn't it? So, really, Jane, I think you need a bit more fluid. It sounds like you're quite dehydrated at the moment. So, I think what we'll do is we'll give you a bit more fluid through a drip quite quickly.
Okay.
So, Kat, can we give a 250ml stat bolus,
Yeah,
please?
okay.
Is that all right? Yeah, do give some 0.9% sodium chloride, please. And actually, can we do a blood sugar as well? Let's check your blood sugar, as well,
yeah,
just in case.
250 mils stat, yeah.
And do you know when you last had any blood tests? Sorry, Joan.
Oh, they struggle with blood tests with me.
Okay, a bit of a challenge, is it? Okay, so
I
maybe
have really difficult veins.
have they managed any today?
I think they tried.
Okay, I'll have a look at that later on then. Okay, so thinking about what's going on, I hope you don't mind me talking, Joan. So I'm happy that your blood pressure's it's a bit low for me, but we're going to try and resolve that with a bit of fluid. You're conscious, you're not confused, so I'm happy with that. Is it okay if I have a look at your tummy now? Do you need any pain at
Yeah. No.
all? Okay, good. Okay, that's fine, don't worry too much. I'll just have a quick press if that's alright. Okay, so it's nice and soft. I'll just have a quick listen. Have you been passing urine okay?
No. I don't think I have at all.
Not at all?
We've
no.
been
Today.
trying to encourage you to drink, haven't we, Joan? But she's just not feeling like it, doctor. Do you
Right,
mind if I come
okay.
and do that blood sugar now?
Oh yeah, please do.
Okay.
Yeah, thank you.
Here we go, just a bit of a wipe. Sorry.
Okay, let's just have a quick look here, 1 second. Okay, so Jane, I think because you're not passing much urine, what we may need to do is just a scan of the bladder quickly, just to make sure there's not a lot of fluid left over in there, if that's all right. We are giving you fluid through a drip, but if you could try and drink some more water, I know you feel like you're sick at the moment, what we can do is we can give you some antiemetics, so some anti-sickness medication, and we'll get you drinking some more water as well to try and improve your blood pressure that way. Is that okay?
Yeah.
So the blood sugar's 5.3, doctor.
5.3, okay, so that's all right.
Do you want to write up some more fluids?
Yes,
For
let's do
later
that
on.
now.
Go.
Okay, I'm gonna take the drug shot outside, but I finished examining you now.
I've got a
It all
pen,
seems
doctor.
fairly normal, aside from the fact that I think your blood pressure's a bit low and you're a bit dehydrated. Okay.
Okay.
So we'll give you a bit of fluid. I'll check the repeat bloods that you've got. We'll do the bladder scan that I mentioned. And I think, Kat, if we could do an ECG as well, that would just be helpful.
Okay, yeah, that's
Okay.
fine. Okay, so
All right.
bladder scan, more fluid, ECG.
Yeah, and I'll just write that fluid
Okay.
up now.
Are you going to repeat some bloods?
If there aren't up-to-date bloods, yeah, I'll repeat
Yeah.
some bloods. Okay.
Okay, fine.
And could you recheck the blood pressure when the fluid bolus has gone through as well, please?
Okay, so recheck blood pressure.
Okay.
Fine.
All right.
Thank
Thanks.
you.
I'm going to borrow these. Thank you very much, Joan. Cheers.
Thank you.
Okay, Joe, let's get you sorted.
Hello. Hiya.
Oh, hiya, you right? This is the ECG, doctor.
Okay, lovely.
The
Thank
bladder
you.
scan showed 21 mils, that was it. And then the
21
repeat blood
mils.
pressure was 98/50. If that's okay.
Okay, fantastic. No, thank you.
Okay, cool, thanks.
Yes, the ECG looks a bit fast, doesn't it? And those T waves look a bit odd to me.
Okay.
Yeah, they're a bit high. Okay, we'll tell you what. Let's give her another 250ml bolus, if that's all right.
Okay.
The blood pressure's still a little bit low.
Yeah.
And then after that, we'll give another litre over 4 hours as well.
Okay.
Litre of normal
Fine.
saline.
Yep, that's fine. I can do
And
that.
there's no repeat bloods on the system, so I'm going to do some now.
Okay.
All right. Is that okay?
Hello.
Hi, orthopedics F1 here.
Oh, hi, doctor. That lady that you came to see earlier, she's still got a really low blood pressure, and she hasn't passed any urine today.
Oh, right, okay. Well, I mean, I said before that she was dehydrated, so I had another look at the blood tests.
Okay.
And yeah, it looks like she's dehydrated, really. So what I would do is I'd give her another, at least her normal saline over 4 hours, I reckon.
Okay. I mean, I have got that prescribed, so as long as you're sure.
Yeah, just give her another litre. Yeah, thanks.
Okay, thank you. Bye.
Yeah, we should probably think about an escalation plan as well.
Hiya, you alright? Yeah.
Hi,
Hi.
you one of the ward doctors?
Yeah, I am. I'm well.
I'm
F1.
John, medical reg. I've just been seeing one of your patients actually. She's had a Met call. It's a Joan Brown, 86-year-old lady.
Oh yeah, okay.
She's been hypotensive all day. We're just waiting for the ABG to come back now.
Okay.
Here we go. Here's the ABD, doctor.
pH 7.2, oxygen's 12.3, CO2's 3.4, biocarb's 15, sodium's 144, and the potassium's 6.8. Okay, fine. So she's hyperkalemic, she's acidotic. We need to start some treatment. So could you get some calcium gluconate, insulin dextrose, please, and she can have some salbutamol nebs.
Okay.
Do you know if she's had any recent bloods at all?
So I did bloods this morning. I sent them off to the lab, but I didn't do an ABG or anything.
Right, let's have a look and see if those bloods are back.
Okay, right, yeah, I'll go and do that now. Yeah, thanks. Hi, John. I've just checked the blood results. So
Yeah.
the creatinine's up at 430 and the urea's 31.
Okay. So it sounds like she's got an AKI, and this is a new change?
Yeah,
Okay.
yeah.
Fine. So I think she should have a catheter. We'll make sure that we're giving her the treatment for the hyperkalemia.
Okay,
I'm
yeah.
going to speak to ITU now, okay, and we'll come up with a plan going forward.
All right, okay, yeah, sure.
Hi Doctor, I'm Jamie. I'm one
Hi,
of the critical
hi,
care
Jamie.
outreach nurses who attend the Met calls with the doctors. If we can start thinking about doing a treatment escalation plan, have you ever seen
Okay.
one of these?
Not really, but I can have a look at it.
Okay, we fit it as a team effort, so the medical and anaesthetics as well, and we decide what limits of care we're going to provide for the patients as
Okay,
well.
fine. Yeah, sure. I can get this prepped. Are we going to fill
Yeah,
this
if
in
you
together?
start filling that out, once I've spoken to ITU, we'll go see the patient's family, and then we'll come up with a plan. All right.
Okay. All right, great. Thank you very much. Yeah, cheers.